Assalamualaikum and good day to all lecturers in Sampris USM. Together with my group member, I will be presenting our research proposal based on two goals in the 2030 Agenda on Sustainable Development. Goal 3, Good Health and Well-being, and Goal 11, Sustainable Cities and Communities. Study topic is the influence of urban population aging on needs of elderly-friendly public facilities in Kuala Lumpur. And the presenters will be myself, Rosliza binti Abdul Hamid, Abdul Aziz bin Mazuki, and Muhammad Shafiq bin Muhammad Jafri. Population aging is an increasing of individuals defined as old and vulnerable who require special attention from society. Economic rapid growth in Malaysia had a positive impact on socio-economic changes such as improved education, employment, and at the same time decreased birth and mortality rates, which lead to increasing of elderly. Santo and Sarvono 2003 defined the elderly as a weak group because of declining health, poor physical condition, lack of ability, lack of care, and relatively poor health condition. Elderly in Malaysia will double from 7 to 14% in just 28 years, compared to Sweden, which has taken 112 years for the same change. Malaysia is heading towards an old country, when the total population of 60 years and above has recorded a total of 9.3% of population in 2017. And Noraida 2016 suggested that the percentage will increase to 15% by 2030, which occurred in Japan in 2010. Socio-economic developments give the opportunity for men and women to further study to higher level and secure good career, where lead to late marriage. While there are married couples practice family planning, and some also decide not to have children, resulting in decreasing of young people and increased elderly. Economic Planning Unit EPU in 2014 report explained that many public facilities were built in Kuala Lumpur due to population density and high job opportunities, as well as active socio-economic activities. But there is still an issue whether the elderly can fully utilize these public amenities. Considering all above issues, we present this problem statement. The aging population in Kuala Lumpur has shown a fluctuating pattern because only some of the elderly live permanently in Kuala Lumpur. Others mostly live in their hometown after retirement. Public amenities in Kuala Lumpur, such as interconnected public transport, health facilities, and public services, difficult to access by the elderly because of the location or inability to move around independently. Although government has already provided necessary facilities, the attitude of some people who are less concerned cause the elderly to have problems while using public facilities. Awareness campaigns should be done so that the culture of helping and caring of the elderly will become a culture of urban residents.
The research questions in this study are: A. What are the public transport facilities for the needs of the elderly? B. What are the public health facilities for the needs of the elderly? C. What measures are appropriate to the community to help urban seniors? The objectives of the study in this study are: A. Analyze public transport facilities for the needs of elderly. B. Analyze public health facilities for the needs of elderly. C. Propose appropriate measures to the community to help urban seniors. Based on tables show that the elderly population is 60 years and above, most countries show an increase every year. Among them, Asia is 6.8% in 1950 and in 2020 it is 13.0%. But there are also countries that do not show significant improvement, such as Africa and Oceania. Based on the table show an increase in the population of Malaysia from 1970 to 2010. At the age of 0 to 4 years show an increase of 1.6 million in 1970 and increased to 2.5 million in 2010. In addition, this increase also involved the population aged 60 years and above. If you look at the table, there is an increase between the 3 years, and this proves that Malaysia is now heading toward becoming an old country. Public transportation studies on transportation show that mobility or travel acquires the most dominant demand among the population based on true travel activities derived from the activity pattern or lifestyle of the local population. Several past studies has shown that mobility and the ability to leave home are important in the quality of life of the elderly, and the ability to use the transportation system with the assistance has long been defined as one of the seven most important things in instrumental activities of daily living on the welfare and quality of life of the elderly. Population aging in most Western countries has challenged the ability of transportation system to facilitate the mobility of the elderly, such as vehicles, passengers comfort, information provision, road system, and public transport quality are factors to consider. Therefore, public transportation are very important in sustainable development goals to create a sustainable cities and communities. Quality of life among the elderly is gaining attention due to the increasing number of elderly people, and there are various efforts to improve the quality of life, health, and social of the elderly. According to Lowski, he said that development involving the elderly still has challenges, especially in the issue of improving the quality of life, which consists of aspects of health, well-being, and enjoyment. Health among the elderly is an issue that needs to be emphasized and is an aspect that affects the quality of life. According to Wan Ibrahim and Zainab, the health aspect is one of the most important aspects in improving the quality of life of the elderly. Study has found that health factors are one of the most important factors to influence the quality of life among the elderly. Quality of life among the elderly places emphasis on individuals with the disease as compared to individuals without the disease. Therefore, health facilities are very important in sustainable development goals to have a good health and well-being.
Primary data collection involves the use of questionnaire. The questionnaire provided contains several sections such as respondent background, employment information, source of income, level of health and treatment facilities, information on household, living arrangement for the elderly, social contact information, daily activities and facilities provided to them. For secondary data, collection will involve information obtained from the Department of Statistics Malaysia, the statistic of the increase in senior citizens, the distribution of senior citizens by area, and the distribution of senior citizens according to socio-economic status in Malaysia. For developed country and developing country is obtained from the United Nations. And for the senior citizen in Asian countries, Southeast Asia and in Malaysia are obtained from the Journal Book and Magazine.
We hope that the results of this study will produce individuals who are more sensitive and help each other to face a problem.
In conclusion, the aging of the population is the process that every country will face, especially developing countries. The increase in the elderly has caused various responsible parties in creating elderly-friendly public facilities to enable them to carry out their daily activities like ordinary residents. We can learn more clearly about the current pattern of aging population and its influence on the needs for the elderly-friendly public facility as well as educational measures that can be done to cultivate the spirit of helping the elderly in the city.